Welcome to our fourth part of the Cardiovascular Physiology revision series, which is based on MCQs. Today we have a set of MCQs on arterial blood pressure regulation and physiology. In a 21-year-old healthy student, which vessels have the lowest velocity of blood flow? So the key words here is the low velocity of the blood flow. So we have different types of vessels. We have veins, capillaries, arteries, and venules. So which one has the lowest velocity? Of course, the correct answer is the capillaries. The reason for that is the capillaries have the highest cross-sectional areas. It means it has so many branches. Okay, we have so many branches at the capillary level. And the capillaries are the blood vessels which present very close to the tissues to supply the tissues with nutrients and oxygen. So the blood flows slow down there to provide time for the gas exchange and supply of nutrients to the tissue. So the correct answer here is capillaries. Activation of efferent sympathetic nerves increase blood pressure by increasing. We know that sympathetic increase blood pressure. So does sympathetic increase blood pressure by many mechanisms? So we need to pick which one of these is related to the role of sympathetic in blood pressure regulation. So is it by increasing RR interval? RR interval, that is in ECG. We have BQ, R, S, T. Then we have another beat, PQ, RST. So RR interval indicates the time between the heartbeats. So if the time between heartbeats increase, that indicate actually bradycardia, decrease in heart rate. And decrease in heart rate is going to decrease, not increase blood pressure. And sympathetic actually increase heart rate. So this is a wrong answer. By increasing AV nodal delay, we know in the heart we have between the atrium and ventricle, we have here a node, we call it atrioventricular node, which help to conduct the impulse from atrium to ventricle. And normally there is a delay at the AV node to allow sufficient time for impulse to move from atrium to ventricle. And what is the effect of sympathetic there? Of course, the sympathetic decrease that delay because it's going to increase the velocity of conduction along the conductive system of the heart. So again, that is wrong answer. By increasing the peripheral resistance. Peripheral resistance refer to the resistance on the arterioles, mainly arterioles, contribute to the peripheral resistance. And peripheral resistance, as it increase, blood pressure increase. Blood pressure is determined by two main determinants. Two main determinants determine blood pressure: cardiac output and total peripheral resistance. And total peripheral resistance, it changes based on the diameter of the blood vessels. So if there is vasoconstriction, that is going to increase the resistance. That is the most important factor which determine peripheral resistance. So as sympathetic causes vasoconstriction, so it increases peripheral resistance. And when it increases peripheral resistance, that is going to increase blood pressure. So the correct answer here is C. Option D is also wrong because sympathetic increase heart rate by decreasing the permeability of the muscle to potassium, not increasing it. Because if there is increase in the permeability to potassium, we normally have the potassium inside the cells. We have more potassium as compared with outside. So if the permeability increase, the potassium will go out by concentration gradient. Okay, so if you bring potassium out, means the cell we hyperpolarize. Hyperpolarization of the cell means we are getting far from the threshold for and the action potential, and that will actually contribute to the decrease in heart rate. And that is not happening with sympathetic. That happens with parasympathetic. So the only correct action here for sympathetic is actually increase in the peripheral resistance, and that directly contribute to the increase in the blood pressure based on that equation for the blood pressure. The primary reason for stimulation of renin-angiotensin aldosterone system is the decrease of. So we know renin-angiotensin aldosterone system is known also as the long-term regulation of blood pressure. So when our blood pressure decreases, the blood flow to the kidney, renal blood flow decrease, and when renal blood flow decrease, kidney release renin. That's why this system is known as renin-angiotensin aldosterone system, because the primary factors that's going to be released or primary enzymes that is going to be released and start the whole process is the renin. And renin comes out from cells in the kidney, which are known as the juxtaglomerular cells. These cells are sensitive to the change in the renal blood flow. So once there is a decrease in the renal blood flow, these cells release renin. So our answer here is, okay, is it this system will be activated or stimulated? Is it the direct and primary reason? Is it the decrease of the blood pressure, or is it the decrease in the renal blood flow? So we are cornered now between these two options. So the direct and primary reason for renin to be released is the renal blood flow. So if we have a decrease in blood pressure that didn't result in a decrease in renal blood flow, this system will not be activated. Okay, so this means this system will be activated only with a really low blood pressure in the circulation, which exceeds the ability of the kidney to auto-regulate its own blood flow. So the decrease in blood flow result in activation of this system. So the correct answer here is a decrease in renal blood flow. That is the primary and the direct factor which causes the stimulation of this system. Which of the following causes an increase in blood pressure? So we are looking at the factors that increase the blood pressure. Stimulation of beta-2 receptors. We know beta-2 on the wall of the blood vessels, they actually causes the blood vessel to dilate. Okay, so it causes vasodilation. So when we have vasodilation, what happened to the pressure? The pressure decrease. The pressure is going to decrease. So that is wrong. It's not an increase. Anemia. Anemia means decrease in the number of red blood cells. And red blood cells in the circulation contribute to the blood viscosity. And the blood viscosity contribute to peripheral resistance. Okay, so one factor I mentioned earlier for determination of peripheral resistance, which is the diameter of the arterioles. Vasoconstriction increase resistance, vasodilation decrease resistance. We have another important factor, which is the blood viscosity. How thick, how viscous is the blood? So the higher the viscosity, the higher the peripheral resistance. So decrease in number or count of red blood cells decrease blood viscosity. Okay, decrease the viscosity of the blood, and that actually contribute to a decrease in blood pressure, not an increase. So anemia actually will cause a decrease in blood pressure, especially diastolic pressure. So that's why this is wrong. Polycythemia is the opposite to anemia. Polycythemia means increase in the number of RBCs. Red blood cells increase. So RBCs increase means blood viscosity increase. Blood viscosity increase means peripheral resistance increase. So this is correct answer. Option D, increase the firing of baroreceptors. Baroreceptors, these are the stretch receptors, which are sensitive to changes the blood pressure. So these receptors are linked to parasympathetic nerve. So increase in the firing of these receptors will increase parasympathetic activity. And the increase in parasympathetic activity will cause vasodilation and the inhibition of the heart, vasodilation and the inhibition of the heart, and that will result in a decrease in blood pressure. So increased baroreceptor firing, remember that increased firing of baroreceptor, that actually indicate an increase of parasympathetic stimulation to heart and blood vessels. So increase, which of these factors increase blood pressure will be polycythemia. On standing after prolonged sitting, which is a compensatory mechanism for the decrease in blood pressure. We know when we are sitting or lying down, okay, when we are sitting or lying down and suddenly we stand, so suddenly you stand. So what happened is because of the gravity, because of the effect of gravity, the gravity will cause pulling of the blood towards the leg. And that will decrease venous return and decrease cardiac output and decrease blood pressure. But what happens is we normally, when we change our posture, when the decrease of the blood pressure happens, the baroreceptor, which is sensitive to the blood pressure change, they detect the change in the blood pressure and they stimulate sympathetic. Sympathetic causes vasoconstriction. Okay, vasoconstriction. So this vasoconstriction increase total peripheral resistance and increase blood pressure. And sympathetic also activate our heart. So when sympathetic activate heart, that is going to increase heart rate. That is going to increase heart rate. So here, the options provided are increased firing from baroreceptor. This, as mentioned earlier, that is wrong because that is going to worsen the condition. That is not going to compensate the decrease in the pressure because it's going to decrease it more. Vasodilation, again, that is not a compensation. Compensation means feedback, something to correct it. So that is not going to happen also because that's going to worsen it if we dilate the vessels. Tachycardia, yes, correct, because tachycardia increase in heart rate will increase cardiac output, so heart rate increase. That is going to increase cardiac output, and increase in cardiac output increase blood pressure. So this is the correct answer. Rapid respiration, that is doesn't contribute much to the increase in the blood pressure is, of course, tachycardia. Tachycardia is the primary, one of the primary compensatory mechanisms to the decrease in the blood pressure. When the radius of the resistance vessels decrease, you have here resistance vessel, radius decreased. Which of the following will be decreased? First, what is the resistance vessels? These are the arteries. Radius of the resistance vessel decrease means they get more smaller, right? The radius decrease means the vessel gets constricted. So when we constrict the vessel, so what is going to decrease? Is it the capillary flow? Of course, here if you have here an arteriole. So the arteriole has the blood if it's and it goes to the capillary. So if you constrict the arteriole, means less blood will flow into the capillary because you are narrowing it down. So that is going to decrease for sure. So decrease in flow. Systolic pressure is going to decrease? Of course, no, because here we have an increase in peripheral resistance, and the increase in peripheral resistance increase pressure. Mainly diastolic, but systolic also increase. So this is also wrong, and peripheral resistance, as I mentioned, is going to increase. So vasoconstriction leads to increase in peripheral resistance and increase in blood pressure. Vasoconstriction to arterioles will result in a decrease in the blood flow to this particular capillary or tissue. The label C in the picture refers to, label C, we can see here, C refers to a blood vessel. So we will be needing to say, okay, is it dilation or constriction, or is it an increase or decrease in peripheral resistance? So let's first understand what is this picture about. So this picture shows the baroreceptor reflex. Once there is a disturbance in the homeostasis of the blood pressure, you see here baroreceptor is stimulated, means the pressure is high. So we understand here blood pressure is high, that is stimulate baroreceptor, and stimulation of baroreceptor causes inhibition of the vasomotor center. Vasomotor center causes vasoconstriction. So if it is inhibited, that will cause vasodilation. And vasodilation decrease peripheral resistance. And when you decrease peripheral resistance, you decrease blood pressure and you bring it back to normal. So the correct answer here is a decrease in peripheral resistance. Which factor contributes to lower pressure in veins compared to arteries? So veins, we know that venous pressure is much lower than arteries, despite the fact that veins have more blood volume as compared with arteries. And the main reason for that is the compliance. Veins have higher compliance as compared with arteries. That's why they have lower pressure. The thinner wall also contribute to the higher compliance of the veins as compared with arteries. But the main concept, the main factor contributing to the difference in pressure between artery and vein is actually the high compliance of veins. What is the mean arterial pressure of a 53-year-old man with a blood pressure of 150/90? 150, that is systolic. 90 is the diastolic. So if we minus them together from each other, we get what is known as pulse pressure. So here pulse pressure is 60. 60, that is the pulse pressure. So main arterial pressure equal diastolic plus 1/3 pulse pressure. So this means it is going to equal 90 plus 1/3 of 60 is 20. So it's 110 millimeter. 110 millimeter mercury is main arterial pressure. So that is the correct answer. A 53-year-old man presents with a headache, blurring of vision on examination. his blood pressure is 145/90. Renal blood flow in this patient is expected to be. This question tests a very important concept related to auto-regulation of renal blood flow. So renal blood flow is maintained constant despite wide variation of blood pressure. So there is a range, we call it auto-regulatory range for renal blood flow. And that range is from 80 to 180. So a change in the mean arterial pressure between 80 to 180 will result in no change in renal blood flow. Renal blood flow will be maintained constant. So the correct answer here is will remain actually normal, because the change in the pressure here is within the auto-regulatory range of renal blood flow. A patient with chronically elevated blood pressure, which parameter is most likely to decrease cardiac output in this case? Elevation in blood pressure for a long time can lead to heart failure. The reason for that is while the heart is contracting, it actually contracts against high resistance. We have here high pressure for a long time. So this is known as afterload. So the increase in afterload will tend to decrease the cardiac output. Of course, initially there would be like some responses to adapt and accommodate, trying to maintain cardiac output constant. Like, for example, the cardiac muscle will hypertrophy. There will be hypertrophy of the cardiac muscle, trying to reduce cardiac output. But the elevation, the chronic elevation, is actually an increase in afterload, which tend to decrease cardiac output. Okay, so the main factor here that is going to decrease cardiac output is the increase in afterload. A 35-year-old woman develops a postpartum hemorrhage. So this means she lost blood. That caused a drop, of course, in blood pressure. We lose blood, our blood pressure is going to decrease. So the decrease in blood pressure results in an increase of which of the following from the kidney. This one we discussed already. So this is renin. So renin is an enzyme that is released from the juxtaglomerular cells of the kidney in response to a decrease in renal blood flow, which happen due to a decrease in blood pressure. And this activation of renin-angiotensin aldosterone system is very important in long-term regulation of blood pressure, because this system causes salt and water retention and trying to bring the blood pressure back to normal by retaining fluid by so many different mechanisms. A 40-year-old man has his supine and standing blood pressure measured. The measurements shows an increase in diastolic pressure on standing by 10. As I mentioned earlier also, when we change our posture, there is a tendency for the blood pressure to decrease because of the effect of gravity. But we have a compensatory response, and that compensatory response causes two things: causes tachycardia, increase our heart rate, and causes also increase in peripheral resistance. Increase in peripheral resistance increases blood pressure, mainly diastolic pressure. So diastolic pressure is mainly affected by change in peripheral resistance. So that is going to increase diastolic. So normally, if we measure in a normal person, if you measure the standing blood pressure and you compare it with sitting or supine measurements, you will find the standing blood pressure, the diastolic pressure is higher by 10 millimeter mercury, and you will find heart rate is higher, and that is normal. That is the normal response. So the correct answer here is vasoconstriction, which causes the increase in diastolic pressure. So remember, diastolic pressure is mainly affected by total peripheral resistance, and the total peripheral resistance is mainly affected by diameter of the arterioles. A 65-year-old man presents to emergency department after a syncopal episode. He lost consciousness while getting up from the chair as he was watching TV at home. He has no nausea, no chest pain, no shortness of breath. The patient has two similar episodes of lightheadedness. He is an old, we can see. He has lightheadedness when he changed his posture. He is on treatment for hypertension and BPH, and his blood pressure is on supine is 149/90, and on standing 116/75. Once we see readings for the blood pressure on change in posture like supine and standing, that already is a clue for you that there is a postural change in the blood pressure. And if you look at the difference between systolic on supine and systolic on standing, for example, so you see here, there is a decrease in systolic by more than 20, and for diastolic pressure, if there is a drop by more than 10, that already diagnostic for what is known as orthostatic hypotension or postural hypotension. Means when we change our posture, our blood pressure decrease, and that is normally is compensated. In a normal person, that is compensated, but in patients who have like hypovolemia, or they have they are on medications, which like antihypertensive medications specifically, because these medications tend to dilate the blood vessels. So when they stand, sympathetic try to constrict, but is not able to overcome the vasodilator effect of the blood vessels. So vasoconstriction doesn't happen in these patients. That's why the blood pressure decrease when they change their posture. So the compensatory response that is lost here is vasoconstriction, and the reason for that is because of the medication, because they are on medication for blood pressure, which causes vasodilation. Mostly it's here alpha blocker.